If you have frozen shoulder, I want you to stop and watch this right now. Now, how do you know if you really do have frozen shoulder? Well, there are a couple things. One, it's some of the most excruciating pain that you've had. You have what we call a capsular pattern, which means your external rotation going out is the most limited, then abduction's limited, then internal rotation's limited. And that is the pattern of how your capsule is shrinking like a shrinky-dink. The pain seems to get worse at night. I believe that is because I think your immune system kicks up at night. I have not read this in research in regards to frozen shoulder, but I believe that is why, because there is an immune piece to this cytokine storm of hell in your shoulder. So you have frozen shoulder. Did you know that there's 3 stages? And yes, you can do physical therapy. Physical therapy can be very helpful for frozen shoulder. Hear me out. I know you've had a bad experience. I know. It depends on where you were in your healing process with how good or bad your therapy was. There are 3 stages of frozen shoulder, and what it is freezing, the initial part very painful, frozen, where it doesn't hurt as bad, but you're not getting motion, and thawing, which means the pain comes back, but you're starting to get more motion. And frozen shoulder is a very self-limiting problem. You are going to stop moving your arm, which technically makes it worse, but you are in so much pain you can't help it. Common conservative treatments for frozen shoulder would include non-steroidal anti-inflammatories, oral steroids, steroid shots into the shoulder, and physical therapy. Steroids are the gold standard of care when you're treating inflammatory diseases, such as things that have cytokines, like frozen shoulder. I also think because you're not moving and it needs that blood flow to feel good because it is so tight. So I think it's multifactorial. So near complete loss of passive and active range of motion of external rotation of the shoulder, because the shoulder itself shrinky-dinks down, your coracohumeral ligament, it affects where your supraspinatus and infraspinatus are. It also affects the coracohumeral ligament lives on top of the long head of the bicep, so there's referral pain there. Now, how long do each of these horrible stages last? Well, in the freezing stage, it can last 2 to 9 months. So that's the initial pain, terrible. Then there's a gradual kind of change. The pain gets better. It really, really freezes and just stays put. Then you reach frozen, which can last 4 to 12 months. And then after that, the pain gets worse. You start to get more motion. That's thawing, and that's 5 to 26 months. Although adhesive capsulitis is often self-limiting, usually resolves in 1 to 3 years. But that's if you don't do other interventions. We can facilitate the healing process and make you speed things up. From this article, here is a nice little figure showing the clinical presentation of your frozen shoulder. So this is why me, a physical therapist, is talking about this, because there are things we can do to help keep your shoulder warm, move, facilitate things towards healing. Home exercises are one of the best things that you can do, such as pendulums, dangling your arm, and I will show you that in another video. Now, when physical therapy and home exercises are combined with NSAIDs, it's shown to be more effective because as you are doing physical therapy, you're warming the tissue, which brings increased blood flow, which facilitates healing, which helps the ligaments remodel, because you can't heal things without actually remodeling them in terms of soft tissue. But we also have to be respectful of pain. But we know that there's cytokines, so there's massive inflammation. So yes, that's why NSAIDs are helpful. That's why steroids are helpful. Now there's also intra-articular, otherwise known as steroid shots into the shoulder, which used in combination with physiotherapy results in a better outcome compared to just the shot alone. Because this is a multifactorial problem, well, it helps to have many options of things to do to heal it. But this is why you have to go to your doctor and talk to your doctor if you have frozen shoulder, and stop doing it on your own. Yes, exercises are the first line of treatment, but you might need some help. Okay, you're hurting. If you're watching this, I know you're hurting. And finally, so if you have frozen shoulder that is primary, you have to address to fully heal the underlying chemical cause. If you are diabetic, get your blood sugar under control. If you have a hypothyroid issue, talk to your doctor. Get your thyroid under control. If you are in menopause and your estrogen is low, you know what I'm saying? If there's estrogen receptors in the tendons and capsules, and if you're telling me during menopause that there is a problem with remodeling, and if estrogen helps control inflammation, and if estrogen is important for the extracellular matrix, and if you are in menopause and you wake up and frozen shoulder is happening and your thyroid's fine and your blood sugar's fine, please talk to your doctor.